Well, this wildfire smoke we've seen this summer is having an impact in a lot of ways, especially when it comes to health. As Sammy Selena shows us, it's sending more people to the ER.
City sites aren't as clear this week.
So I actually normally have a really nice view of the US Bank Stadium, and you cannot see that at all.
Dr. Dorothy Curran is a pediatric pulmonologist. She helps kids with respiratory issues at Hennepin Health.
We definitely saw an uptick in phone calls to our pulmonary nurse line, especially from kids who have underlying asthma or have underlying respiratory needs.
The Minnesota Department of Health says preliminary state research shows an increase in ER trips from children and people with respiratory issues during and after air quality alerts.
There's a lot of particulate matter, and they'll travel down the respiratory tract down to the base of our lungs. And then actually cause swelling, and some of those very fine particles can actually pass through the lungs into the blood.
Smoke can worsen respiratory conditions or lead to an increase in developing them. Health officials say you should limit the time that you spend outside, but some people just don't have a choice.
Being a concrete finisher here for the city of Minneapolis, we're outside year-round. All different conditions.
Eric Sherrado works outside every day in construction and says he hasn't felt the impacts.
It's just another day. We just keep working, you know. Haven't thought much about the long-term effects, to be honest with you, no.
In fact, Dr. Curran says research is underway now to figure out how wildfire exposure, summer after summer, impacts the health of Minnesotans.
We know that pollution in general can lead to increase in respiratory conditions, we know that in kids that are exposed to pollution, we see higher levels of asthma in neighborhoods that are high pollution areas.